So I'm Annie Ebener. I'm the school nurse for the district, and I think we can just kind of jump right into the PowerPoint, and we'll go through it.
Okay, I'm going to share my screen. Oh, and you know what? I just put it. There we go.
So we can go to the next one. Next slide. So just a little bit of my personal background. I'm originally from Southern California, born and raised, and I did my undergraduate at the University of Oregon. I did not major in anything healthcare related. I majored in psychology and sociology, thinking that I would go into counseling or something along that line. And from there, I went into the Peace Corps. And while in the Peace Corps, that's where I really kind of got redirected into healthcare. I spent a couple of years in Senegal, West Africa, doing health extension. So a lot of work on malaria and prenatal care and HIV/AIDS and things like that. So when I came back from that stateside, I went back to school for nursing and became an RN. And I started off as an RN in the hospital setting, just in med surg and oncology, doing chemo and cancer patients, all the while continuing to go to school and completing my master's and family nurse practitioner license. In 2009, I moved up to Sonoma County, and at that time, I took a position up in Ukiah, commuting every day in their family practice office at Adventist Health. And I still actually continue to work there a couple of days a week. And then in August of this past year, this incredible opportunity came out and this position opened up, and I was lucky enough to be brought on as the school nurse at West. And so it has been quite a year to be a school nurse for the first time, but it's been really, really great growth and learning experience. So let's go to the next slide. So today we're going to talk about a few things. I want to go over health protocols for the district, specifically COVID related. I want to spend a little bit of time about the vaccine, and then I'm going to finish up talking about self-care. Okay, we'll go to the next one. So for health protocols, all the health protocols that we have in place in the district are in full alignment with the California Department of Public Health. And even drilling down further than that, locally tuned to Sonoma County Public Health. And we have a great relationship with public health here. They're very responsive. We're in frequent communication with them. And as guidance changes from them, our protocols adjust as well. I also want to mention the Sonoma County School Nurse Association. This group is a local network of over 45 school nurses, and there's just such a deep reservoir of experience and skills and just years in practice in this group. And this group shares resources and expertise and has been a great resource as we've navigated the past year. And then of course, the protocols are, something that I also help develop and to make sure that we're responding appropriately as guidelines change and situations change in current conditions. And even though I personally am not on every campus every day, we do have trained staff on campus every day who are fully aware of the protocols and also know that they can contact me at any time to clarify anything that might feel like a gray area. Okay, we can go to the next one, Lisa. Okay, so basics, masking, and a lot of this is going to be review for a lot of you, but I think it bears repeating. We only want our students and staff and everybody on campus to be wearing a 2 to 3 layer face covering that's going to cover both your nose and your mouth. That's going to protect you and your kids, and that'll protect everybody around you and your kids too. And we want to be sure you're washing your mask every day if it's a cloth mask. Next slide. The one mask that I would just, really recommend not wearing, not okay to wear a mask with an exhalation valve or a vent. A mask like that, you're just breathing out unfiltered air. And so that airspace is contaminated. And so the people in that airspace are not protected. So we don't want, a mask with a valve or a vent on it. Next slide. Now, when deciding, I know that this is something that we've talked a lot about, but I think, again, it bears repeating. Deciding whether, to keep your kids at home or not, if they're symptomatic. If they have any one of these symptoms, you really want to be sure you're keeping them home. So a fever of 100.4 or higher, a cough, sore throat, trouble breathing, fatigue, body aches, a new loss of taste or smell, a headache, congestion or runny nose, nausea, vomiting, any single one symptom of those, you want to keep them home. Now, if it is something like, your child has seasonal allergies, they have a runny nose, kind of chronically every, April to June, that's a different story, but we do need documentation from their provider so that we know that, it's an established diagnosis. We know for sure this isn't COVID and that it won't be being brought into the cohort. Go to the next slide. To expand on that, so we don't want you to send your student if they, or really anybody in the home, has signs and symptoms of COVID. We all know that with COVID, it's often more pronounced in adults. So if there's an adult in the family with COVID symptoms, you want to play it safe and keep your kid at home until you've established that it is not COVID, and or been in close contact with anybody that's been COVID positive within the past 10 days. So, if that's the case, then you're going to want to be in quarantine until that 10-day mark. Or, of course, if there's been a positive test, for COVID, either of the student, of course, but also for a family member within those 10 days. And if there's a question, just, contact the office and we can talk it out, because, there are some timing issues and nuances that we want to be real precise about. So when in doubt, just contact us and we can talk out the timeline. Okay, next slide. When in doubt, don't send your student to school, keep them home, call the front office. And this next line, it always makes me kind of smile, because I sent my middle daughter to a preschool where a lot of the parents were healthcare professionals, and the office manager would joke about the 1 o'clock fevers, because these doctors and nurse practitioners and nurses would give Tylenol at 7:30 a.m. and send their kids to school, and then at 12:30 or 1, they'd be spiking fevers. So don't do that. That was all pre-COVID, of course. And, don't give Tylenol or ibuprofen and then send them to school. Okay, just keep them home if they have any of those symptoms. Go to the next slide. Now, sometimes you might, your student is totally healthy, fever-free, feels good when you drop them off, but maybe they get sick and develop a symptom or two during the day. So if your child gets sick at school, we have developed a care room protocol, and every campus has a care room established. Every campus, we have trained staff who are there, all the time. And so essentially, if your student becomes ill during the day, one of those trained staff members will come and accompany them to the care room. And the staff will be wearing full PPE, so they're protected. And then your child will wait in the care room, and it's comfortable. We've got chairs, we've got cots, we've got, a high grade HEPA filter going, and they'll wait there until they can be picked up. When you're called, we really want to be sure you're there within 30 minutes of that call. Don't let them languish for an hour and a half. And having your emergency contact list up to date can be really helpful to make sure we're getting a hold of you quickly. And then returning to school after having COVID symptoms, we have kind of a whole action tree that we follow, and that's all following guidance from Sonoma County Department of Public Health. And I'll go into detail on the next slide here. So if your student stayed home or was sent home for COVID-19 symptoms, this is kind of the basic criteria. So the first bullet point, either they test negative and or their healthcare provider provides an alternate diagnosis. So maybe you don't send them to school because they have a headache and you're not sure if it's a headache from a viral infection or a headache from dehydration or a migraine or whatever it is. They go to the doctor is 100% sure that it's a tension headache and not COVID, and they write a note and they sign off on it and they date it, that's adequate. Or a negative test, and they meet this other criteria to return. So no fever for 24 hours without using fever reducers like Tylenol, ibuprofen, no GI symptoms, nausea, vomiting, diarrhea for 24 hours without using antiemetics or anti-diarrhea medication, and then feeling well enough to do their regular day-to-day stuff. Public health guidance stipulates that those individuals who decline to test, they can decline to test, but you need to complete 10 full days of isolation following onset of symptoms and meet this other criteria: fever free for 24 hours and all symptoms have improved. Okay, we can go to the next slide. I want to touch on recommendations after travel. This is strongly recommended that if you're not vaccinated, and that goes for all of our students because the vaccine is only approved in ages 16 and older. If for those who are not vaccinated who have traveled, particularly out of state or out of country, that you test 3 to 5 days after your return to Sonoma County and quarantine for 7 days. And that's 7 days applies even with a negative test. And then if there's no test, then the recommendation is to quarantine for 10 days. So this is really a strong recommendation to protect not only your family, but your cohort and everybody that you're in contact with. Okay, we'll go to the next slide. So if there is a positive case on campus, everybody who is on campus that day, so all the teachers, all the staff, every student and family of a student who is on campus that day will get a letter or an email saying there's been a positive case on campus. And it's just like a general exposure letter. It'll say, your student was not exposed to, isn't believed to have been exposed directly or close contact, but we're notifying you that there was a positive case. Those individuals who are considered close contacts will receive a second letter, a close contact letter, and they'll be directed to quarantine for 10 days from the last day of contact. And that last day of contact counts as day 0 of the quarantine. If there's a positive case within a cohort, a student or a teacher, then we get in contact with public health, and public health is going to offer guidance on the impact of the cohort. The current guidance packet that came out from Sonoma County just a couple of weeks ago kind of leans towards closing the entire cohort if there's a positive case within a cohort. But that being said, we will address it on a case-by-case basis in collaboration with public health. We'll go to the next slide. So this is not COVID related, but I wanted to touch on it because it is health related. If your child needs medication while at school, an albuterol inhaler, an EpiPen, or whatever it might be, you do need to complete a medication authorization form. We have copies at the front office. We can email them to you. We can get them to you, you know, however is most convenient. But this needs to be completed by both you and the provider before your student can receive medication at school. So you'd complete it, your provider, and then bring it in with the medication. Okay, we can go to the next one. Okay, so I wanted to talk a little bit about the COVID vaccine, even though our students, of course, are not yet of an age that they will get it. It affects our whole community and our reopening and everything. So the COVID vaccine, and I will say, you know, it is a personal decision, and everybody has the right to choose whether or not they get this vaccine. I do recommend it from a healthcare perspective. So the 3 vaccines we have currently approved, we have 3 of them. Pfizer, 2 doses, 3 weeks apart, 95% effective. That is it. Honestly, that's an astonishing number and really, really amazing. Moderna, 2 doses, 4 weeks apart, 94% effective. And the Janssen J&J vaccine, 1 dose, 72% effective, and very effective against the variants. The most important thing about this slide is this bottom part. All 3 vaccines are almost 100% effective against hospitalization and death. So for a virus that in 14 short months, you know, has left 550,000 Americans dead, you know, it's really what it really comes down to is that this vaccine will protect against that. We'll go to the next slide. There are some side effects that are pretty common. I mean, I'd say I think the data shows about 75% of people get 1 or more of these. So to be expected, but temporary. Some fatigue, headache, body aches, fever, chills, tends to last for a day or 2 and then it's gone. And it's good to remember that those side effects are a good sign. It means that your body's mounting that immune response, they're producing antibodies, and the antibodies are what will ultimately fight off COVID if and when you're exposed to it down the road. And severe reactions like anaphylaxis are really rare, really rare. I think it's 2.5 out of every million. So, you know, just exceedingly rare. But that being said, they're always prepared at these vaccine sites to respond to anaphylaxis, and and just in case. But it rarely happens. Okay, we can go to the next slide. Sonoma County is doing awesome. We're 9th in California out of 58 counties, and the data isn't 100% current on the SoCo emergency site. I only, as of today, they only posted up till April 6th, but right now we've got nearly 33% of Sonoma County adults fully vaccinated and 21% partially. So you can project 3-4 weeks down the road, we're going to be over 50%. Okay, go to the next slide. And then this graphic is a little bit blurry, but probably make it out. Herd immunity, we get there one of 2 ways. We can get there through infection and kind of all the destruction that happens along the way, through mortality and hospitalizations and that kind of thing, or we can get there through vaccination. And so you can see here, vaccination is all about breaking those chains of transmission. And when you've got 0% of people vaccinated and 0% of people immune, because, like 14 months ago when it was new to our county, there's nothing breaking those chains of transmission. When you get to 25%, it's better than nothing, but it still is pretty easy for it to spread. 50%, now you're starting to see a little bit of a dent made in the ability of it to spread. 75%, which is usually, a target, like a minimum target for herd immunity. And now you can see, those chains of transmission are really starting to get limited. You can trace them and track them and try to lock them down. And then of course, 95%, you've got a total lock on the virus at that point. Okay, we'll go to the next slide. Okay, so I wanted to finish up just with a few slides, pivot here a little bit about anxiety and self-care and things like that. I know with returning to school, there is a ton of joy and relief and, like, for parents, jubilation, honestly, but also anxiety, and that all can coexist in the same space, I think. And so I think with anxiety, both for parents, but primarily for our kids, it's important to have conversations and ask questions about how our kids are feeling, um, and listening to what they say. And sometimes what they worry about aren't the things that we think they're going to worry about, but when we hear them, we can respond to them and validate them and offer reassurance. And I think it's important that this piece about it being okay to have unknowns, like the past 14 months has been nothing but unknowns, I feel like. So communicating that is really, really important. And then being positive. I feel like our kids really adopt, I think, our attitudes a lot of the time. So presenting these new situations in as positive a tone as we can, even when it's kind of like a challenging situation or a daunting situation. Encouraging flexibility, just knowing that, that it's constant change, right? The past 14 months and probably going forward into the foreseeable future, in everything, teaching and learning and working and everything. And earlier this week, I was having a conversation with one of my colleagues in the clinic. One of our doctors had this great analogy with how we're all kind of like a stream or a brook, and we're just going down, we're down the stream, but we run into a boulder and we have to find our way around, and we just have to be flexible and continue to do that. And then optimizing health and safety practices. If the anxiety is related to some, worry and concern about, these very legitimate health concerns, then optimizing all the things we can do to stay healthy is one way to feel more confident about that and lessen that anxiety. So all the things we've been talking about for over a year now: hand washing, mask wearing, distancing, getting vaccinated when it's your turn. And then self-care, I'm going to go into it the next slide. Next one. And honestly, I will just say, I kind of roll my eyes a little bit when people talk about self-care, because I've got 3 little kids who are 7 and under, and who's got time for self-care? But it is actually really important, and I feel like that's become so important, and clearer than ever in the past year. So things that we can all do: implementing a schedule or writing out a to-do list. I think that structure and predictability in a time of vast unpredictability is helpful, just mentally. Focusing on controllables, I think that kind of mindset is key, again, in an environment where so much is out of our control. I coached a high school cross country and track team for 6 years, and we would frequently talk about focusing on the controllables. And when the girls would complain about how hot it was on race day, Yeah, I would ask, can you control the weather? No. Well, what can you control? Oh, we can be well hydrated before the race. So same thing with taking care of ourselves. Why waste and expend all this energy on things that we can't do anything about? So I think that's important. Taking a gradual approach. You don't just get dropped off on top of the mountain. You have to climb it one step at a time. So it's too big to look at things sometimes when you focus on the end point, just going day by day, hour by hour even. Um, Practicing mindfulness and having a few minutes every day. And honestly, like that can be your drive to work if you have that time. Um, or just some little bit of time that you carve out to be able to do that. Deep breathing, stretching, walking, anything to reset. You can go to the next one. And then I think, choosing to do something fulfilling. So volunteering, music, drawing, writing a letter, having a healthy diet, balanced diet. Um, I know the days that I have ice cream for dinner, I never feel very good. And so, having a balanced diet can help just feel help your body and your mind um, stay level, I think. Sleeping, that is so key. We all know how hard it is to feel balanced when we're not getting enough sleep. Taking a break from the news, I found this to be really important, um, particularly in the beginning of the pandemic, and just really choosing my sources carefully, but sometimes taking a full break from where you're getting your information, because it's easy to get overwhelmed with a lot of bad news. Logging into your support system and then knowing when to ask for help. All right, so we can go to the next one, which is the last one. So we are in this together, and and I'll take any questions that anybody has.
So I'm going to look at the chat and we will see what we have. I have a question about, is nausea and upset stomach a symptom that we need to get them tested after?
It is, because it is, GI symptoms are listed among COVID signs and symptoms. So like so many other COVID symptoms, they mimic what could be many other things, and a lot of the time ends up being not related to COVID. But right now we're always erring on the side of caution, and either testing or seeing the provider and getting clearance from the provider saying, okay, this is clearly a gastroenteritis where it's not COVID related, and if we have that note, they sign off on it, then that also would qualify.
Okay, I don't see any other questions in the chat, Annie.
Okay.
And if anyone wants to unmute themselves, we have a small group, so you can definitely unmute yourself and ask a question if you'd like to. I will stop my share and, oh, I'm sorry. Okay. So I just had someone saying that they just want to thank you for providing this information and for your time. So thank you.
Thank you everybody for coming out. Yeah, I know everybody's so busy, so thanks.
Thank you for going over all that, Annie.
Oh, sure thing, Nick.
Appreciate your time.
Happy to be here.
Thank you.
Okay. Well, we'll stay on the meeting for a few more minutes. If anyone has questions, you're more than welcome to stick around or put it in the chat. And if you are good to go, then we'll invite you to click leave and have a wonderful rest of your day. And thanks so much for attending. We really appreciate it. So, and Annie, you're wonderful. So we're so grateful to have you as part of our district.
Oh, thank you, Lisa.
And I will stop our recording.